Okay, so we're putting a wound vac on here. These are what's called the window pane. It's about 1.5 inches. So what you do is you can see you put the clear protection. I put benzoin all around.
Okay.
And then you window pane it around these thin strips. And the reason why you do this is to protect the normal skin. Okay, you do not want the sponge to get on normal skin. Here you can see this is adaptic, and underneath is the split scalp graft. So that mesh that you see is skin that I took from the back of his head, meshed it, and I put it onto his foot. Now here we have the sponge that I've cut, and you notice that because I protected the skin, it can overlap a little bit, and that's okay. If I didn't do that, I'd have to be very careful about not putting the sponge onto normal skin. A wound vac is actually dangerous to normal skin.
Oh, wow. That's
It's safe only onto skin grafts.
Okay.
So then I take larger pieces like this. Okay. Rotate your foot towards me. Okay. Keep coming towards me even more. I've got the perfect size here to finish it off.
Cute scissors.
Yeah, you like the cute little pink scissors, huh? They match my gloves.
Your gloves.
Yeah.
For breast cancer awareness. I love it.
I know.
Very nice.
I started wearing them just for breast cancer awareness month, and I wear them year round.
Right. Perfect.
Okay, now the next part, which is very important, this is, I call the lily pad, but it's officially called a sensor track. There's a suction port, which is here, and there's 4 sensors, 1, 2, 3, 4. Okay?
Okay.
And that's gonna go in the middle.
Oh.
You gotta cut the hole big enough, about the size of a quarter.
Okay. Not the sponge, just the window pane.
Just the plastic.
Okay.
Since it's his leg, you want this to go up towards him. So the center of this hole,
towards the heart.
you wanna go right over where you just cut.
Okay.
Okay, you put that on, then this comes off. Once you stuck it down, then you pull the blue one. Now, this is the actual wound vac here. It's called the ActiVac. Now you can see this is the suction canister. You push it in, nice solid bang, there you go. You want to turn it on. Now, make sure this is unplugged. You don't want to, because if this is locked like this,
it'll block the flow.
You got to take this cap off.
Okay.
And now connect it like
to
this.
The machine. I got it.
And then turn it. You see there's a little knot. You want to make
Kinda
sure that
like
this
the other one.
You want to make sure that neither of them are clogged. Okay.
Closed. Leave them flowing.
Now,
Okay.
once we establish an air seal, then everything will suction down. You can see how it's
Very
there you go.
interesting.
See? Now, there's different settings you can put it on. For instance, I can go into therapy, settings, intensity. I can go to high, pressure. I could go up to 200 if I wanted to.
But what do you want to leave it at?
Usually you leave it at 125 unless it's causing problems. So we'll see if we go to 125, we'll see if it stays. So 125 high continuous is where I'd like it to be at.
Intensity.
So right now,
Continuous.
I have it set to 125 and it's pulling to 125, so I'm happy with that.
Okay.
If this number reads less than 125, then you go into pressure and you hit the up button, and you may have to go up to, let's say, 150 to get it to read 125.
Oh, I understand.
Now, this is reading correctly 150 and 150, so I don't need to do that. So I'll leave it at the 125 high continuous. And I think we're good to go.